Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is Tuesday, April 18th, 2023. And we are here today to discuss a very, and all of our Your Healthy Javas are very, very important. But this one, and it's interesting because we had two of these folks with us kind of a year ago today, not the exact date, but on the third Tuesday in April, we had Dr. Jean Lambert and also Jasmine Irvin come in, and we had Winnie, and I don't remember her last name, but she was part of this panel as well. And we were talking about substance use. We learned that we don't say substance abuse anymore because we understand that this is an addiction and a sickness, and not putting that ownership on the person that is dealing with this. There are a lot of drugs that are infiltrating our community for years, for decades. But here of late, there have been a lot of presumed alleged deaths due to overdosing of fentanyl. And then I'm also aware that there is a synthetic form that sort of what some would classify as recreational drugs are being used. And I know I'm working with two professionals in substance use, so I'm going to be very careful with my words. But we thought it was important today, and we're going to ask you to share this greatly. And I know I ask often, hey, hit the share button. But no, this is some information that we need to make sure is out in our community about its proper use, the synthetic form of it, and at worst, the dangers that come with using it. And so without further ado, I would like to bring in both of my guests, who are Jasmine Webb, who is the practice manager at the SUDS Clinic at Massachusetts General Hospital, and also Dr. Jean Lambert, who is, I believe, the director of the SUDS Clinic at Massachusetts General Hospital. And so thank both of you for being here today. I'm going to go ahead and say that they both are on some away time and self-care, and they found it not robbery, as my bishop father used to say, to be here and ensure that our community gets this information. And so, Jasmine, I'm going to start with you. Since you're locked in with us, two testosterone holders, we'll start with you. And please introduce yourself and tell us a little bit about yourself, and then end your introduction with one word that describes the state of fentanyl, specifically in our community, Black and brown communities.
You always like to give me a little assignment, so don't worry. I'm not worried about holding my own with you two gentlemen this morning.
Absolutely.
Good morning, everybody. Thank you so much for having me. My name is Jasmine Irvin. I work at Mass General Hospital. I'm an administrator, so I oversee our substance use disorder clinical operations. We have 5 different departments that I oversee. And I also do a lot of community work and health equity work, making sure that people in my community and people that look like me have knowledge and access to fair and equitable treatment here at MGH.
Absolutely. Thank you. Dr. Lambert, how are you?
Wait, I forgot my word. Wait.
Oh, yes.
Fentanyl right now. It's very scary. Very, very scary.
Absolutely. Dr. Lambert.
Good morning, and thank you for re-inviting me and Jasmine to talk about this important and timely subject. My name is Jean Lambert. I am the medical director of the Addiction Counsel Service at Mass General Hospital, and my clinical work is focused mostly on managing hospitalized patients who have substance use disorder but are admitted to the hospital for a myriad of other reasons, including complications from their substance use. And We have a team of professionals, including providers, recovery coaches, social workers, that really try to get at not only the reason why individuals are struggling with substance use and substance use disorders, but actually at the historical reasons, and specifically focusing on the trauma that our community has experienced, which in some cases result in substance use disorders. Happy to be here. And my one word for fentanyl is awareness. We need more awareness about this drug and what it's doing to our community.
Absolutely. Dr. Lambert, I'll jump right in there with you and ask you there, I'm aware of this saying out there that if you don't know the purpose of something, you will. And I know that abuse is a word that we don't use in this space anymore. But that saying says, if you don't know the use of something, you will abuse it or use it in the wrong manner. Fentanyl is can you just give us sort of a fentanyl 101?
Sure. Fentanyl, we can look at it in two different ways, right? There's pharmaceutical fentanyl, which is used in the medical industry, medical practice, has a potent synthetic opioid that is very commonly used in procedures and surgeries, has an anesthetic or analgesics. And what that means, it's has tremendous properties in terms of reducing pain. So if someone is undergoing a surgery and they'll have surgical pain, they could get fentanyl to reduce that pain and sometimes eliminate that pain. And it's been around since the 1960s, actually manufactured by Dr. Janssen in 1959. So this is not a new drug. This is a drug that's been used for decades. That's pharmaceutical fentanyl. And some of the properties of pharmaceutical fentanyl, which makes it an attractive drug to use in the hospital or in the medical industry, is that it's 100 times more potent than morphine, which was one of our original pain relief medications. And it's 50 times more potent than heroin, which is not a medication we use in the hospital, but the one has been used historically as a recreational drug. It has a short-acting half-life. It's rapid onset, and so it's ideal when you're trying to get rapid control of someone's pain, especially if they're having surgery or a procedure. The other spectrum of pharmaceutical fentanyl, it's used for chronic pain. Someone who has chronic pain and require pain medications continuously around the clock, fentanyl has properties not in terms of injectable fentanyl, but transdermal fentanyl that you apply a patch and you can have delivery of that medication, certain amount of a dose every hour continuously. And it's a very effective form of pain for patients who have breakthrough pain, who have cancer or have metastatic cancer. It's also used for chronic pain, individuals who have chronic pain for a number of reasons. Fentanyl is one of the opioids that's really used in that scenario. The other end of the spectrum is not pharmaceutical fentanyl. It's actually illicitly manufactured fentanyl and its analogs. And this is what we're talking about today. This is the fentanyl that's causing increasing percentage of drug overdose in this country since 2015. And when you look at drug overdoses in this country, 2015, you looked at the number of drug overdoses, 15%, 18% had evidence of fentanyl. We fast forward to 2021 and 66% of the drug overdoses in this country during that year had evidence of fentanyl. So it has changed the dynamics and the nature of the illicit drug supply in this country. And along with changing the dynamics of the illicit drug supply in this country has also contributed to an increasing in 2021 historical record number of drug overdoses in this country.
Dr. Lambert and Jasmine, we're going to come with you. I think it's important to make sure we get all the information that we can from Dr. Lambert. And so for clarity, this is typically a drug that is prescribed inpatient typically IV? Is there a, because when you talk opioids, we know that they were prescribing different type of opioids for folks to take post, dental procedures and whatnot. Is fentanyl also prescribed on an outpatient? Was it at some point also prescribed on an outpatient? And is it as addictive?
It is as addictive as any other opioid,
Okay.
but it's one of the more powerful opioids. And so when you think about the armamentarium of medication, pain medication, opioids that a provider can have, when you're reaching for fentanyl, you're reaching to treat severe pain. You're reaching to treat pain that's not going to be managed by other common opioids like oxycodone.
Okay.
Yep.
All right. Jasmine, I'm going to come to you. And based on what Dr. Lambert just shared, how much of that, what is the communities from your perspective? Let me, as you say, I always give you an assignment and a long question. Is the community aware of what Dr. Lambert just said as far as, how are we viewing what's going on in the community with fentanyl? Let me ask you like that.
Yeah, I mean, I've been in the community probably the last 16 months or so, just talking to people and, learning and joining different task force. And a lot of what I see is a lack of knowledge. A lot of people don't know about fentanyl at all. When we go and we talk about it, it's like a new thing. Yeah. Yet the rates of opioid or fentanyl overdoses in our community are the highest than anyone else. So it's really important for us to make sure that we're educating ourselves about this topic.
And absolutely. And one of the things that I'm aware of, and Jasmine, you tell me because you're in community and you work in the space, is there, from my observation from social media, the rumor mill and stuff, folks that look like you are a large part of that large percentage of Black and brown folks that are dealing with this. I'm aware that there are a lot more women of color that are a part of this number. And so between the two of you, I don't know who wants to go first. Let's talk about stats as far as, and as local as you can make them, fine. If you can't on a national, that's cool as well. So maybe Jasmine, what are you aware of as far as the impact in our community?
Yeah, I know. 2019 to 2021, the highest opioid death rates are 02121, 02119, 02122, 02125. That's Dorchester, Roxbury, and also.
Can you do me a favor and say that again? Either Lasagna or whoever's in here, catch those numbers and put them in the comments for me. 02121.
02129.
Yep.
02121. 02125. 02124. And 02126.
And those are rates of death or overdose?
Overdose deaths.
Overdose deaths. And do they break down any no demographic, right? Just the zip code.
No, I can pull some. I mean, for Black and brown people, when it comes to unintentional opioid overdose deaths, our Black males are up 178%, and our women are up 252%. This is the stuff I look at work, and it breaks my heart.
And so from a community, what? So Dr. Lambert, you named, and we can just have this conversation here. You named that there's, since 2015, we've noticed an increase, but then 2021, you can't help but just wonder, was it what was the transition? Is it and you didn't use the word synthetic, you used illicit form of fentanyl, illicit form of fentanyl. What happened? Like, what happened?
So there's a number of factors, but I would tell you, as we think about the opioid epidemic and its origination in the late 90s, early 2000s, when it was prescription opioids, then it transitioned because of federal policy, state policies that try to control the supply of prescription opioids, controlling how prescribers or physicians were prescribing these medications. It caused a lot of individuals who had an addiction to prescription opioids to seek an alternative source. That alternative source was heroin. And what happened when there was this shift from heroin, we saw rises in opioid deaths related to heroin. And then, unfortunately, 2014, 2015, because we live in a capitalistic world, fentanyl was discovered to be, one, cheaper to manufacture, easier to distribute, and the return on investment was tremendous. A kilogram of heroin you could buy for $6,000 and, I don't know, sell for $200,000. A kilogram of fentanyl would make you $1.6 million. And these are just numbers I'm just quoting. Yeah. They can be a wide spectrum. And so the market started manufacturing fentanyl. And because you already had a society that was addicted to heroin, they naturally transitioned to fentanyl, right? And so what happened in that time was fentanyl, heroin transition to fentanyl, still impacting white communities, less so Black communities. And then I would say around 2017, 2018, it started to impact communities of brown and Black individuals. And that is when you started seeing the drug overdoses that are related to fentanyl starting to increase in the community, in communities of color, to the point where in 2020, the drug overdose death rate for Black communities outsurpassed white communities for the first time in history. And so, like a lot of other things in our history, where we suffer from systemic and structural racism, I'm talking about HIV, AIDS, hepatitis C, it first impacts white communities, and there's federal, state response to try to control how it impacts those white communities. And then unfortunately, it happens to flow downstream and starts to affect communities of color, where the response, federal, state, local, is not as robust as it is when dealing with white communities. And that's where we are right now, struggling to make individuals in the community aware of fentanyl and its history, and then trying to get our legislators at the federal and national and state and local levels to really invest in trying to address this issue as it permeates our communities.
Jasmine, again, I see you looking at numbers there, just from you being from the community as well as Dr. Lambert. What is the daily impact that you're seeing of not having this awareness and the lack of the aggressive response now that it's infiltrated? And Dr. Lambert, just for clarity, you were talking legal fentanyl just in that context there. We haven't even talked about the illicit form, and we'll get into some conversation about lacing. And, you know, there's speculation or observation that like types of marijuana and certain perks and stuff are being laced with fentanyl. But Jasmine, what are you seeing on the day-to-day, the impact on humanity?
Well, I see a lot of stigma, right? And so people judge people who use drugs. And for whatever reason, there's judgment. There's, people are sometimes on a moral high, or they think that their way is better. And they think that however they think people should get treatment is the way they should do it. And they're not always interested in hearing about medical intervention or medical treatment. And I think,
go ahead. I'm sorry.
No. Yeah. And I think the other thing is like a lack of awareness and a lack of education about what is really happening and, what the treatment options are.
Is there, and I'm going to ask a very interesting question, and I almost asked it as if it was, there is prevention, obviously. There is of not using, and this is just the legal version, version of it. Let's talk a little bit, Jasmine, about this lacing. You hear rumors about it's being put in marijuana. There are other fake pills like perks and whatnot. It's being laced with, and people. Let's just be very real. There. Dr. Lambert had named a couple of recreational, drugs or drugs that are used more in a recreational manner, and so folks are going recreationally, buy some weed, no opinion, perk, whatever other recreational of their choice, and it's being laced, and they're finding out a lot of times via death, or are there chances? So both of you all said yes, there's not a lace, and then you get sick and they go and pump you, and then you're okay. Most of the time, you find out it's lace. The percentage is usually by death after autopsy and finding it in the system. Jasmine, and then Dr. Lambert, your perspective there.
I mean, I can just say that there have been a few people in our community who've passed away, and it's from overdose, and they were sniffing cocaine, right? And there was fentanyl in their cocaine, and they didn't know, and they overdosed, and it's really sad. And there are ways that you can prevent stuff like that. You can test the drugs that you're using if you're not ready to stop using drugs, to make sure that there isn't anything laced.
Dr. Lambert, your thoughts there?
Yeah, I think, again, that's the part where we're hoping to make the most significant impact with what we're talking about today is this unawareness, right? And so we know when the drug supply has been tested in the state of Massachusetts, 2021, every sample of cocaine they tested, 12% of those cocaine samples, this is 2021, right? Two years ago.
Yep.
Tested positive for fentanyl. And so if you're a Black individual whose preferred substance is cocaine, why would you think or imagine that your cocaine, which you've been using for months or years, why would you think it's adulterated? And that's when you say laced, I say adulterated.
Yes, sir.
Why would you think it's adulterated with fentanyl? And so what we have is individuals unintentionally having fatal or non-fatal overdoses because they don't know that the drug or substance contains fentanyl. And it's just not cocaine. If you prefer using benzodiazepines and you have Xanax and you have press pills, guess what? Fentanyl is in that. If you're using OxyContin or Percocet, guess what? Fentanyl is in that. The DEA last year seized on order of probably 20 million fake pills, Xanax, OxyContin, Percocet. 6 out of 10 of those pills had a lethal dose of fentanyl. And a lethal dose of fentanyl is 2 milligrams. It's several grains that you could put on the tip of your pencil. That's all it takes to cause an overdose. And if you're not using fentanyl on a continuous chronic basis and have developed a tolerance, you have no tolerance because you're not using fentanyl, that small dose, several grains on the tip of a pencil, can lead to your demise. And so those individuals who unintentionally are not aware they're using fentanyl is where we're struggling to make sure this message goes out to our brothers and sisters in the community. You've got to know that fentanyl is in every single substance you use, whether it's prescription opioids, which you think are prescription opioids, or benzodiazepines, or cocaine and methamphetamine. I would tell you there's a lot of stories about fentanyl adulterated in cannabis, and there's not a lot of strong evidence to support that exists.
Okay. Thank you.
But I will tell you what you should feel reassured is that if there is fentanyl and it's found in your cannabis, it's not intentional. It's probably because the supplier was mixing fentanyl next to cannabis, but there's not enough in terms of that interaction. Because once you light cannabis, you're actually applying a heat source of over 2,000 degrees Celsius, which will degrade and break down fentanyl and prevent it from actually having any detrimental impact. And so there's a lot of stories about,
and this is why we're here,
cannabis lace fentanyl, but there's been no true confirmation that it has caused any overdoses.
Okay. Dr. Lambert, thank you for that clarity. Jasmine, I'm going to jump to you because I seen you were still looking, and I'm going to, there are a varying number of opinions about the term harm reduction in many spaces. I first heard it when we were moving in sort of we would tell kids, if you're smoking 3 blunts a day, can you drop down to 1, and can you roll that 1 with papers? That's that perspective. When it comes to issues of dealing with opioid crisis, There's a couple of opinions, but this is interesting. And so we're going to go here for a minute. And I will say, just to cover both of you, this may or may not be the opinion of Massachusetts General Hospital, but let's talk about the testing. You said that people that just right now are recreation users for cocaine or whatever, they have an ability. They can't stop right now, whatever. They have an ability to test their substance. Let's talk about that. How do they do that? How do they access that?
Yeah, I can talk about the fentanyl test strips. I think, Gene, if you want to get more into like the science of it, but we have fentanyl test strips that we supply either out of our out of the 2 vans that we have in our community. And you can come on the van or come in the clinic and someone will teach you how to test your drugs if you're still using, because the thing behind this is we want to keep the person alive, right?
Yes.
The longer somebody is alive and the longer someone is safe, that's another day for hope and another day that somebody may.
Jasmine, can you do me a favor in the private chat? Can you put either a phone number or a way that we can get that information out there? Real Boston Media is in here. And so this clarity is needed. And so, Dr. Lambert, we learned from you that the likeliness of fentanyl, because there is a rumor that, they lace it, they're lacing the weed. So it's really the carefulness needs to be if their recreational choice is in press pills or cocaine and not knowing the source, and they need to seek you guys out and get those test strips to be able to. We're having a real conversation about helping our community. And as Jasmine said, stay alive, because if you stay alive one day, there's another day of hope. So Dr. Lambert, not so much the science of the test strips, but how important is it that people, if they're struggling with that use, how important is it that you get the test strips and use them?
I mean, it's life-saving, right? And so I would say, if you're using any substance, try to think about its origin, right? And so we know fentanyl precursors originate in China, and they're sent to Mexico, where 2 specific cartels use those fentanyl precursors to manufacture this illicit manufactured fentanyl, what we're talking about, right? And they distribute that throughout the United States, right? And so if you're thinking about your medications that are adulterated or laced with fentanyl, you got to think about the Mexican cartels that are actually manufacturing these medications. And it's not only fentanyl, but it's fentanyl and benzodiazepines, it's fentanyl and prescription opioids. And so they're not really thinking about, when we get to our local communities, cannabis and fentanyl. So that's the point I'm trying to make. Yeah. There are other things that are more concerning, more realistic, more likely to be harmful than cannabis, and whether there's some lacing of it with fentanyl. You should be concerned about fentanyl being laced with prescription pills, benzodiazepine, cocaine, methamphetamines, drugs which these Mexican cartels are actually mass producing and manufacturing, and actually deliberately adulterating them with fentanyl for whatever reason. Yep. And so I'm not so much concerned about cannabis compared to those other substances, where if you're historically using them, you've got to be aware, and just like Jazz talked about, understand how you can get those substances tested and make sure they're not containing fentanyl. And we should put up the information for the Boston Public Health Commission, AHOPE. It's a clinic on Albany Street in Boston. They also do fentanyl testing. They have test strips. It's a walk-in clinic, low threshold, low barrier. Not only do they do the testing strips, they also do education, naloxone education, overdose prevention education. It's a vital resource for our community.
AHOPE at the Boston Public Health Commission.
Yep.
You all know that we'll the Hope. Now I see the Hope Clinic for you all, but a Boston Public Health Commission. There it is. We will put that link up.
Yep. And AHOPE stands for Access, Harm Reduction, Overdose Prevention, and Education. AHOPE.
Okay. And unfortunately, I can't. Let me get to the screen so I can see you all. I'm going to say something that the way I'm going to say it is going to be very real. But if you happen to watch this in the after watch, if you know somebody that's popping pills on that Friday, Saturday night, you need to have a conversation with them and tell them that and both of them are shaking their head. And so it may not be the preferred vernacular, but we got to make sure the purpose of this partnership and your healthy Java is to get information and awareness out to community. And if you know somebody that here and there, you know, you see them in the club or whatever, and they pop a pill or whatever, and they're chilling. And we got, unfortunately, part of culture that is out here promoting popping this and doing that and on this and on that. Have a conversation with your people, because you don't want to get that phone call 4 o'clock in the morning after you saw it. Sorry, I didn't mean to go there. I am going to, anything else that I miss, I'm going to be in the background trying to find a link to A-Hope. So you all will be able to see me, but y'all keep talking because I'm going to try to get this information.
Oh, yeah. I mean, we can just go to February of this year as an example of exactly what we're talking about. That's awareness, right? Nubian Square. There was what we defined and called a fentanyl-related mass overdose event, which is greater than 3 overdose at the same time or a similar location, right? There was a number of individuals, fatal, non-fatal, who lost their lives because they thought they were using cocaine, which unfortunately was adulterated and laced with fentanyl. And again, the same philosophy, same principle we're talking about. They're probably historically used to using cocaine, not worried about fentanyl, have no tolerance. And so that small dose of fentanyl that was in their cocaine was enough to cause a number of deaths. And so this is the reality of what we're dealing with. And this is why Jazz and I every single day are talking about how can we educate our brothers and sisters about the dangers, non-fatal and fatal, of any substance adulterated with fentanyl. It's a message that we have to make clear, succinct, and continue to deliver it over and over until that message is heard.
Jasmine, can I ask you a question that may be sort of not off topic, but you move in this space, you're from community. Some people may not be comfortable. They don't know how to say, hey, sis, I need to, can we have a convo? Off the cuff, I know, but is there any pointer or ways that you maybe employed to start this conversation with somebody that you needed to have the convo with? Let's go there a little bit.
Yeah, I think the first is like a non-judgmental approach. I have people in my family who use, and I've been able to get them access to treatment at my clinic because I just talk to them about their addiction, just like it's any other health piece. I work at MGH. If I worked in a diabetes clinic and one of my family members had diabetes, I would talk to them about their treatment options. And so it's the same way if I have a family member who's an alcoholic and they have no idea that there's naltrexone or Vivitrol or options that can actually help them drink a little bit less, I'm going to tell them about that information because it's important. And a lot of people don't know about it.
And so what I heard was non-judgmental and have the access of information. And we just want to put this phone number back here that Jasmine put up, 617-643-8281. That's to the Bridge Clinic at MGH. Also, there's a hyperlink that I put in that is the link to the City of Boston's Boston Public Health Commission's page with the information for the A-Hope Clinic. We have a few minutes left and we're going to start. I see one question. If you guys have questions, please put them in the comments as we're going to start to take them. We just cited the incident in Nubian Square. We see Kathy Kim, who was in the building, who was very much aware of that impact. And so, Dr. Lambert, thank you for naming that, because I had mentioned to you that we had noticed on social media that there was this naming of a concentration of, it's framed as, DBs, I'll say that, because I don't want to disrespect those that have succumbed to this, but we noticed it, and it was just, it's just so hurtful. And it's interesting because we talk about awareness and information, and we need to make sure we get this out there. Dr. Lambert, what is it that parents can do? Let's go here a little bit. Are there ways that parents can kind of tell, or family members, if their loved one is dealing with the opioid? Because a lot of these parents of some of the young women that I'm aware of, they had no idea
Yeah.
that their children were,
Yeah.
taking pills as a wreck. What are some signs, and Jasmine, you can jump in here as well. What are some signs that parents can look for?
Well, it's challenging to kind of connect with your child if they're hiding or concealing what they're using, right? And so we can all say we have a fantastic relationship with our child or our family member, but if they're struggling with an addiction, right? Part of that struggle, it manifests itself as they feel shame, they feel guilt, they don't want to share that they're struggling. And so, as Jazz says, it's always about having a honest and open conversation, making no assumptions, making no prejudgment. Here's what's going on in our community, son. Here's the things that are going to cost you your life in a blink of a second. It's fentanyl pressed pills, it's fentanyl adulterated cocaine. What's your thought about those substances? What is your experiences? Out of concern and love for me, that's all. I just want to know that you're safe. And you've got to establish that kind of relationship, that kind of open discussion where there's no prejudgment, there's no preconceived notions. And you got to be able to have your loved ones be able to say, I'm struggling. I don't know what to do. I have a loss of control. I can't control the things I used to because of this substance. And that's where it starts. It's a hard conversation because we as a community think of substance use and substance use disorder as a moral failing. It's not. It's actually a chronic disease, just like diabetes, hypertension, any other chronic disease, where the first thing is awareness and understanding. And two, if you're not struggling with substance, we talk about prevention. What do you need to do so that you're engaging in healthy behaviors that don't revolve around you succumbing to the use of substances? And if you're using substances, the conversation is, where are you in your stage of understanding what this substance is doing to you? Where are you in the stage of thinking about, I want to make changes in my life. I want to stop or reduce my substance use. Or are you at the stage where I'm going to keep using? And then we start talking about how can we make it safer for you to use those drugs? Specifically, how do we test for fentanyl and the substance you're using? But it's got to be an open, honest conversation. It's got to be one built on love and trust. And the only person who can, the individuals who can have that kind of conversation is your family members. And so they can't judge. They can't make you feel guilt. They can't make you feel stigma. And then you've got to understand that this is a struggle that's not based on some moral failing, but actually on an addiction that's a chronic medical disease that's going to require some honest, open conversations, not only with your family, but also with your providers about how do I address my substance use if I want to stop, I want to reduce, or I want to continue using, and how do we do it safely if that's the option I'm choosing?
Dr. Lambert, thank you. And Jasmine, mentioned it as well, not judgment. And I did, one of the tenets of this platform is, love is the foundational thing. And sometimes, Dr. Lambert, you're good. That sun is coming in right on time. And look, we'll leave that alone. Jasmine as well. And so, love is the primary thing. And sometimes you may have to love from a distance or practice tough love, but as long as love is the foundational, without judgment, as Jasmine says as well. Jasmine, you put a resource in here, so I'm going to figure out. This is there's a substance abuse support group, and so there's a lot of information. I can't put it all up, but I
can just sum it up quickly. But there's a Zoom link in here. Every Thursday from 5:30 to 6:45, our social worker from the Weston Clinic, Maureen McGlam, she runs a family substance use support group. So if you're a family member of someone who's dealing with a substance use disorder or they're struggling, you don't know where to begin, you just need a little support, some help, maybe you get some advice on how to deal, with some of your peers. This is an open group.
And I can put the link in and people can just pop in with the passcode and the link if they just need support. Okay. All right. We'll put that in the comments. as we get ready to wrap up, folks, let me know if you have questions. I haven't noticed a lot of questions yet. I just want to put this link in the comments so you all can have it there. It's hyperlinked. And so it should be hyperlinked. That's the meeting for the Zoom information. You can just pop in, take a screenshot of this.
Thursdays, 5:30 to 6:45.
Thursdays, 5:30 to 6:45. Thursdays, 5:30 to 6:45, that you can pop in here. And if you need support, there may be an opportunity for you to ask questions in the chat. Or if you have any questions about it, you can contact Maureen at 617-726-9216, or again on Thursdays at 5:45, 5:30. Say it again, Jasmine.
Every Thursday from 5:30 to 6:45.
5:30 to 6:45. And then also, what days are the vans in the community, Jasmine?
I was getting to that, Cindy. Don't worry. So right now, every Wednesday from 1 to 5, we're located across the street from Step Rocks in Moringue in that parking lot there.
Okay.
And then the second and fourth Saturday of the month, we are in the Marcus Garvey Metro Boston Alive across from O'Brien. We're in that parking lot there. We're hoping to get back directly to Nubian Square on Saturdays once the weather starts getting a little bit warmer. But this partnership with both Step Rocks and especially Metro Boston Alive has been great.
Okay. And we definitely Nubian, I call Nubian the hoods, sadly, but like the hoods, mass and cast, because that area around Ziegler and whatnot is just so very interesting. If you guys have questions, go ahead and put them in the comments now. I know many of you are on vacation and enjoying the time off. And again, I want to thank both of you that came in on your day off as well, but it just shows your passion and commitment to make sure that this awareness is to community. So I'm going to go on a blast and email this out to about 300 folks. Y'all need to watch this and have that conversation. I see something else in the private chat to make sure we get this information out. So there is also the Massachusetts Substance Abuse helpline and hotline. So we're going to put that information in the comments and here on screen as well. And so this is the Massachusetts Substance Use Helpline. You can contact them at helplinema.org, or you can call them at 800-327-5050. And let me put that in the comments as well. And so there's the information there for you. James Hill's there. After talk in the same. I know, Sharon, thank you very much. And we know that there's after talk, a little bit of echo in the comments there. Thank you, ma'am. Appreciate you. Always looking out. Sharon Cornelius. I just needed to throw that in there before I get in trouble, you guys. And a little light humor, just because this is a very serious topic for our community. And those numbers around what's going on with our young women is just interesting, and our young men. And Dr. Lambert, can I just ask a very informal sort of hypothesis question? That number with men and the amount of the cocaine that was tested, the number of men that have 100 and some odd, over 20 some odd percent, Jasmine, I think that you named, and the amount of cocaine that tested positive, can we presume that our men of color, their substance choice may be largely toward cocaine? That crossed my mind when I listened to the numbers and those facts.
Yeah, I think historically, Black men have preferred cocaine in the crack form over opioids. In Massachusetts, when you look at services assessed through BSAS, which is the Boston's Substance Addiction Services, you'll see that 6% of white men in the state of Massachusetts use cocaine compared to 12% of Black men. So we have a preference for cocaine, a historical preference for cocaine.
I just heard that when you said, and I'm kind of aware of that, but then when both of you named those numbers, it was just a question that crossed my mind. Jasmine, any closing statements, anything that we missed? Do you all have a flyer of the van availability? If you get me any graphic or anything, I'll post it and share it on Twitter and whatnot.
Yeah, I just want to leave by saying that we have access with whatever information that you hear today, this morning. I want you to share it with as many people as you can. The amount of people who've been coming to our van has been very low, despite the super high numbers of overdose, in use in our communities. And I just want to make sure that we're getting real serious about what addiction looks like for us, and that we start taking our health very seriously, taking the moral clause out of it, stop stigmatizing ourselves, and really get to work with some of the healing in our community when it comes to addiction. It's important.
Absolutely.
And we've got to work together. I know we all have different ideas of what treatment should look like. And that's great, really, because we want to have all these different treatment options, but we shouldn't have to prefer one over the other, right? Because it's really about the patient and meeting them where they are and what they want and what's going to bring them connection at the end of the day. So,
Yeah.
I just heard this term, and Dr. Lambert will let you close, is we talk about mental health and we talk about, physical health. And I don't know if there's this term out there for those that move in this space, but we're going to need to start talking about addiction health. Some people it may make them feel uncomfortable and whatever, but we're going to need to have a conversation in this space of addiction health. I'm sorry. They deserve and anyone dealing with it, and we all are dealing with some sort of addiction.
Yeah.
Caffeine, sugar, sex, shopping, and so I'm sorry. No. Dr. Lambert, please close us out and bring me back.
I would say, and the message consistently is, we're dealing with a new time, a new generation of individuals who are experimenting or using or have an addiction to a substance. It isn't the 60s, it isn't the 70s, it's not the 90s. And so the conversations we need to have with ourselves, our loved ones, is how can we be informed if you choose to use a substance? How can we be informed so that you can live another day, so that you can continue, if that's your path to use, or you can continue to choose a path of recovery, whatever that looks like to you. But the most important thing is you're here, you're alive, and you can make that decision. And the only way you can do that is so that everyone is aware of the dangers that exist in the community and in the substance we're using. And that's the message I continue to harp on. That's the message I continue to focus. Let's be aware. Let's educate each other so that we can live another day to make choices about how we want to live our lives. The most powerful thing is when you lose someone you love and you start thinking about, I wish I'd have had that conversation. Start having those conversations today. Start loving the people in your life today so that they could be here tomorrow, the day after the next. There's nothing more heartbreaking, distressing in a community of color among our brown and Black people when we have to bury one of our own because we didn't understand, we didn't know, we weren't open, our hearts weren't open to understand the struggles they're going through. We need a lot more empathy and compassion. We need to understand the trauma that impacts everybody, where they're coming from, and more importantly, how can we be in their lives so that they're here tomorrow to make decisions, to love, to engage, to appreciate life, and to live another day.
Not a lot needs to be said after that. I just I'll let you guys go and I'll go and promote the health fair.
Okay, Pastor Lambert.
Listen, that right there is a clip all in itself. I appreciate both of you and also Cindy. Cindy's away, but she said she had to tune in. And, the numbers are in the after watch. And so I hope that folks really, as you're watching this, whether 3 a.m. or 2 in the afternoon, share this. Just hit share and get folks out and maybe share a little bit of what in this resonated with you to get folks to understand. Because if you're just coming in now, there's a whole bunch of information that Dr. Lambert and Jasmine shared in the beginning about fentanyl and just this is going to unfortunately have to be an ongoing convo for a while because there's this misnomer that before it gets better. And so thank both of you. And we look forward to seeing you in about a month at the health fair on May 20th. I'm going to go promote that now. Jasmine was Dr. Lambert was with us last year as well. And so y'all hold May 20th. We're going to get stuff out over email in the next couple of days. So I appreciate both of you for coming in. Jasmine, give my brother my best, and we'll be contacting you soon. And Dr. Lambert, thank you as always, sir. And thank you just for your stance when you also speak to the space of policy in which we didn't even touch today. So maybe we'll have to do that as an after dark, so we can just, because there's a fire that Dr. Lambert has that you all, if you haven't heard or felt it yet. So with that being said, thank both of you. And I appreciate you.
Thank you.
Thank you so much.
Absolutely. Listen, folks, this is the reason that why we're here and why we do this. And this was some much, much needed information in our community. You will be able to meet these folks on Saturday, May 20th. I need you all to save the date and help get this out there. The flyer is going up on social media shortly, but on Saturday, May 20th, at the Thelma Burns Building, 575 Warren Street, from 11 a.m. to 3 p.m., you will be able to come and get your blood tested, diabetes test, high blood pressure, COVID. I believe, Cindy, we're going to have COVID vaccine there. The SUDS clinic will be there. Our goal is to have about 30 or so medical and quality of life resources in the room, or maybe outside in the parking lot at the Thelma Burns Building. So please remember, Saturday, May 20th, the Thelma Burns Building, 575 Warren Street, 11 a.m. to 3 p.m. Prizes and refreshments. You can ask professionals health and cancer-related questions. The MGH community van will be there. The health fair will also feature a panel discussion around health equity. And I think Cindy just told us that the SUDS van is going to be there as well. So please make sure you save the date of May 20th. Plan on coming and stopping through. You don't even have to stay. Come through, get the information. The panel is going to be a separate event or registration, but plan on being there on May 20th. Thank you to the Massachusetts General Hospital Office of Equity and Community Health for their continued support in this space. I also wanted to just prepare you guys right now that starting in June, we are going to condense this hour into a half an hour to be, well, one, your healthy Java or Java with Jimmy. I don't care if 80 people are in here from 9 to 9:30. At 9:35, 9:40, it never fails. I don't care what the subject is. Y'all just get ready to go to work. I don't know, something. So we see that and we understand that. And we're going to get the same quality of information to you, just be a little more concise, and spend a half an hour with you for your healthy Java. So that's going to begin on the first Tuesday in June. We are dropping down to a half an hour to ensure that we get as much information to you. I know it's the summertime, and so I know you all won't be sitting at home on the computer. So keep that in mind, all right? Also, I believe that is it as far as announcements. So please share this video with someone. Thank you all for tuning in today, despite being on vacation, and y'all got your children at home with you this week. Maybe we should do a session for you on that, so you can process how your offspring are offspringing you. I'll leave that alone. All right. That's it. Love you too, Ma. Pastor Marion is sending this session out. Thank you. Leslie said, I'm listening while working. Great idea on shortening the show. Absolutely. You all come in for a half an hour. We'll get you the information real quick. We're still going to have questions. There's always going to be time for questions. All right. So, yes, Miss Teresa, and Miss Teresa, look, it's not exactly perfect, but I'll just go ahead and tell y'all, we're giving out keychains at the health fair and magnets, and Miss Teresa is taking care of them. You can't see it all the way, Miss Teresa, but it's on its way. So after I eat, I just got to get it on the computer and fix it. So I will eat, Miss Teresa. Thank you. And yes, really, really, it is coming and it's on its way. Thank you all for tuning in today. Share this and get it out there. Tomorrow, we are scheduled for our third edition of Woke Wellness Wednesdays with Brother Carlin Barrett. So I just need to check with him. And yeah, I think that's it for me today. Don't forget June 21st for your healthy Java. June 21st for Java with Jimmy on the waterfront cookout that is taking place on Wednesday, June 21st. And I think that is it for me. We'll see you guys tomorrow morning at 9 a.m. Have a great day, everybody, and we will talk with you tomorrow at 9 a.m.